Hi, I'm Dr. Alan Austin. I'm a dry eye specialist in Orange County with over 30 years of treating dry eye patients clinically. Today I want to discuss how I incorporate warm compresses in the treatment of my dry eye patients. So many of you are familiar with warm compresses. They're recommended quite frequently for patients with dry eye. So here's how I like to use these in clinical use with my patients. Put them right in the trash. They don't work. So this may sound controversial because one of the more common things that I hear my patients tell me that their doctors have recommended is warm compresses, artificial tears, Restasis, and punctal plugs. We'll talk later about why the other three are probably not the most appropriate for most patients. But warm compresses especially, most of the dry eye patients that we find are inflammatory. So think about what happens when you put heat on a patient who has inflammation. You're just going to ramp up that inflammation. In fact, most patients would benefit more by putting a cool compress on their eyes when their eyes are really inflamed and irritated. So again, warm compresses do have a place in acute styes or issues where you really need to get heat on a specific area, but for general use for patients with dry eye, not recommended.